Just switching gears here, we are going to move into a presentation on the personal protection equipment and just talking about clinical sanitization best practices and some tips on accessing the supplies that are going to be needed. So just to frame the next presentation, I did take a few screenshots of some of the great information that was released by the Saskatchewan College of Physical Therapists practice guideline opening of physiotherapy clinics under phase 1 of the provincial's reopening Saskatchewan plan. So these are posted on the website, but I just wanted to point out a few things so that we're coming with the same starting point when we move into the next presentation. So just a couple notes here. It is advised to check the website for information because there are ongoing updates. So always make sure that you have the most current information. But in terms of the information on PPE, mask use and infection control can be found here. But initially, the Saskatchewan reopening plan is recommending masks and gloves. And gloves, glasses, visors, and a smock or long sleeve coat in addition to the mask if there's risk of exposure to biological fluids during the procedure. All right, then after the appointment, I just wanted to point out recommended some less touch payment types of processes. But then thoroughly cleaning the surfaces that the patient may have come in contact with using a hospital-grade cleaner. And of course, the importance of the hand washing and or sanitizer. Then on the facility requirements, I just wanted to point out a couple of things that are related to our next presentation. So a sneeze guard for protection of the administration staff, or if that isn't present, the receptionist must be trained in the PPE, usage of the PPE, and then wearing it at all times when patients are present. And then the cleaning of the waiting areas as well to ensure sanitization. All right. And then just increased cleaning in general, using hospital-grade sanitization on all surfaces, especially those frequently touched areas. And again, there's lots of resources on the cleaning and sanitization needs. Okay, so that brings us to our next presentation, PPE and disinfecting best practices and tips for accessing supplies with limited availability. So we have Brenda Frey with Stevens Healthcare has joined us, and we are very, very grateful. I asked Brenda to come help out. I asked her yesterday afternoon, so very short notice, and she was able to help us. And this is a very rushed and quick transition for our physiotherapy community. So we appreciate Brenda being able to help out on such short notice. All right, so go ahead, Brenda.
Okay, so I'm just on the main screen here. You can tell due to COVID-19, we're telling everybody what we don't have. So there are, as you are aware, there are some supply issues across Canada, across the world. But that's not what we're here to talk about. I just want to offer, Garnett said there were some questions about mask selections and that type of thing. So I'll start there, and then people can ask Garnett questions if you're open to that. So
yes, absolutely. So any questions you have, please feel free to add them to the question area of the GoTo panel. And we've had a number of members email in questions about what types of masks should be used, what types of gloves should be used. And so, yeah, we'll let Brenda show the different options that might be useful, keeping in mind that, yeah, there's a worldwide shortage, and probably not in the short term would some of these masks and things be available, but maybe long term. And then it'll be interesting to get some ideas from Brenda on how to be creative.
Right, yeah, and that's the main thing. So yeah, for instance, we're only supplying current customers of Stevens on most of the PPE items. We have contractual obligations with health regions across Canada, and we have the moral obligation, obviously, to put every resource we can into acute care right now. So that's where most of the masks are going, for instance. I'll just see if I can get one with a picture. So this is your basic level 1 mask that you see here. So everybody you can see that, Garnett, the PrimaGuard 160, the ear loop.
Yes.
So this would be a hospital grade mask. It's your level 1. So basically it's just for general use. This would be what you would see, different variations, different colors. This is what the big shortage is about. There's a raw material shortage in the world right now. So yeah, definitely. And this is where the price on this type of mask should be in the $10 range per box of 50. You can clearly see that. And that's where the price gouge and all the run up of no supply. So these masks can go for $70 a box now, $100 a box. There's a very unscrupulous pharmacy in Regina at $150 a box, sold their last box. So anyways, near the end here, I will make some recommendations towards more homemade. And these are very scarce, these masks. So I am showing you, this is a basic level 1 mask. Very, very scarce type of mask right now. So very little in terms of that. So that's a level 1 mask. And so there's all kinds of them, as you can see, ear loops, different. I'll just see if there's a different one here that we can show. So that's a different type of manufacturer. So these are all reputable manufacturers. So when you're out in your clinic and you're reopening and you're starting to book customers and there are patients, you're going to get, like the pharmacies get faxes all the time on different ones like this. And they're not to the same quality. So certainly you're not all buying apples at $70. So even if you all want to go out and buy the really, really marked up masks, there's a high chance you're going to get a counterfeit or a very low quality mask, unfortunately. So we'll go, these are the shields. So we'll go to shields, a little bit more, we'll jump here. And so, because they did
Brenda,
mention shields.
Any tips on, so it sounds like there's a big variety of quality, any tips on being able to identify the level of quality of some of these products?
So here, I'll go back to a mask. So buying from somebody reputable, obviously, so someone that, here, I'll go to a tie-on mask here. Buying from someone that you, like although most of the companies now are limiting who they're selling to just current customers, knowing who you are buying from, knowing the brand, but it's very precarious. This is probably the most sought after items far and away, the surgical mask, the level 1 mask. And really, unfortunately, part of the problem, I'm sorry, I can't find a good picture of a surgical mask here. Let's see here. Okay, so that's a tie-on mask. So this is another level 1 mask. So the problem obviously is all the reputable distributors like Stevens and all our competitors, they're all tied up, all of their resources into acute and law enforcement and corrections. So we can't take on any new customers. So then you have, it's kind of like you're buying a surgical mask from the people that supply the dollar store type of stuff. So I guess who you would buy it from, the brand, but even N95 that's made by 3M, there's all kinds of counterfeit, and on Amazon buying on Amazon isn't even a guarantee either. So I don't have a lot of good news on how to buy the mask unless you have some sort of connection. But near the end, I'll talk about where you can get these masks in more of an industrial setting. So the surgical people, the healthcare companies like the one I work for, we're all completely committed with all of our inventories into acute care, but the industrial people still have tidbits of stuff that are coming in because there are other industries that have some carryover with masks. So I'll move over to more of an N95 mask because that's the one that gets all the news. So basically the levels of masks, the difference is the particulate, how much your protection is, essentially. So you go from general use to, you go to basically protecting from TB, hantavirus, asbestos abatement, those type of things. So they completely filter everything with the mask. So I'll just show you the N95 masks. Let's see if I can get on here. And so they're more a respirator, if that, so if we can say mask versus respirator. And so the dentists, and you are all going to be out competing for PPE against all of your other professions like dentists, chiropractors and that type of thing, they all need, when they open up, N95 masks, I guess, which is going to be a tough one. So on the screen here is the N95. So that's an actual N95 mask. It's got the cone, so it has to be fitted. And so really for your purposes, this would be a very expensive option. I wouldn't recommend trying to procure them. If you had them, that would be fine. There are no-name brand N95 masks. So I do have one that's made by a reputable company out of the US, and we just happen to have them sitting in our garage. So you may have some of these that you don't know about, or your neighbor that's a woodworker or whatever. Like, they're very similar to a dust mask, if you can see this. So definitely we've kind of looked at 2 or 3, but this is kind of more for particulate aerosols, but this is what the dentists have to find before May 4th, and that would be very challenging. And of course, in Saskatchewan, there is a shortage, so they are actually autoclaving or disinfecting these by high heat steam because there is such a shortage of them. And so this, just for an price wise, this 20 of this N95 should cost about $35 a box, maybe $45 a box. And they're now in the $500 range in the secondary market. And again, you're not guaranteed to get anything that's real because they're very good at counterfeiting these types of items, unfortunately. Back to the tie-on masks. They're only meant for really 20 minutes, right? So if you're expecting a staff member to wear one of your masks that you've bought, they're only really meant for one use, right? So it's not good in terms of what you're going to need, right? So this mask, if you had it, you were able to procure it, you had some sort of source to buy it, really, it's not meant for a full shift, right? Like, people could take it off or what have you, but it's going to get wet. That's the problem. As you get higher up in the levels, and really that's the difference between a level 1 and a level 2 and level 3, the longer the procedures go. And unfortunately, most of the level 2 and 3 masks really aren't available besides in high level acute care centers and more procedure centers. So they're not really available to the public at all. So that's why even at the highest level of Health Canada, Dr. Tam, that's in charge of Canada's strategy, they didn't really even go out and say right away that they even recommended public to have them, because they didn't really know about the efficacy, and then they've recently changed their minds. But they're, I would not recommend spending a lot of time and money trying to procure these masks that are very hard to get and very expensive. And as far as I know, the government hasn't said no to homemade masks. It's what my understanding is. It doesn't say health, because you would be taking away from that market that's going into the acute care if you all went after all the hospital masks. So I don't think they want that either.
Right. Yeah. So there would be very few aerosol generating medical procedures that physios would do, and so the
Right.
N95 masks should likely go to the practitioners and settings that that they would be needed, and just physio when absolutely needed.
Okay, so that would be they're wearing a mask. That's what you would see in the hospital. Non-fog. There's a significant shortage of the shields as well, but they seem to be more, other manufacturers have been able to procure them and to change their manufacturing lines to make them. So there are some Canadian shields being made. So, and it has the band right here And those say single use, but you can wear them for a full shift.
Right.
Is there any question about the shields, Garnett?
No, that's good. A few more comments. We do have a number of therapists in acute care facilities. So there has been a point in terms of best practice with the N95. It would be, it may become ineffective if there's anything that touches the outside, like a cloth mask
Right.
over top. So that might be a challenge with that system. And again, SPA, we wouldn't, or SPA isn't in a position to recommend what type of mask, and cloth masks or any particular kind. It's just more problem solving and some ideas, but SPA wouldn't be able to approve or recommend any specific kind of mask. All right, so then gloves, Brenda, do you have any examples of gloves, and what would be differentiating factors of gloves?
So the gloves, for your purposes, because there's not fluid involved in your procedures, so you would want I'll go to the, you want the non-sterile vinyl is what you would want. Let's see if we've got some here. An example. Okay, so that's more of a powdered latex type of glove, but essentially the big difference is what you're going to counter, and there is a gloves shortage. All the gloves are made in Malaysia, they're made in China. There's significant shortages in gloves and that type of thing, but essentially you have vinyl versus nitrile. The vinyl is used more for general practice, non-fluid, non-bodily fluid type of procedures. So, and you can use them for ultrasounds. So the radiologist use them for that. And there is a significant price difference when you get to nitrile. So I'll go to nitrile, and there is a significant shortage in the nitrile market. So definitely you'd want to stick to vinyl if you're able to find them.
So Brenda, there are some scenarios, frequent scenarios that physios would touch bodily fluids.
Okay.
And so, we have both private and public here. So
Okay. So then the nitrile glove is the option you would go for, obviously, and that's how it's categorized. In certain clinics, they go for obviously the nitrile gloves. I'm just going to go nitrile glove here. I'll look here. And they're very easy to pick out in terms of, here we go. So this is what they use in the hospital. So any of the caregivers, obviously the professional physiotherapists, they're in the hospital. Sorry about this, I'm not doing very well on the pictures. And there's many, many choices. So this is single packet, but they come in packs of 100. So this is, and I guess the big thing is to remember nitrile. So nitrile versus vinyl, if you've never brought in gloves into your clinic before, sterile versus non-sterile. So I don't think any of they would be using that, but let's see here if we can. These are more of a specialized nitrile glove that I'm showing here. Let's see. So again, nitrile gloves. So for instance, I phoned around yesterday, and it'll take us into our next, which about the plexiglass. And I phoned it, and I don't have any affiliation with this business at all, but Warm and Home Center. And so they have the plexiglass that they're talking about protecting your admin people with, but they also sell nitrile gloves. So there is a big shortage of nitrile gloves, but that's the idea of where we're going into these industrial settings and finding these items where you normally wouldn't think of finding them. That doesn't mean it's going to be easy to find them, but certainly they are still out there right now in limited quantities. Is there questions about the nitrile gloves or vinyl gloves? Pretty straightforward. In terms of price, there has been a bit of a run up on price. So vinyl gloves are in the $5 to $10 range, typically for a box of 100, and the nitrile is more like a $15 to $20, depending on where you buy them for the nitrile. So the nitrile is more the high level class 2 from Health Canada type of product, tighter and more fluid resistant would be the big thing, better fit, and for longer type of procedures. So in the hospital, it would be almost all nitrile.
There's a question here. Can gloves be washed, I guess more in a desperate scenario, can they be washed for 20 seconds with soap and water if the glove supply becomes a huge bottleneck?
I wouldn't be one. That would the government would have to be able to weigh in on that, because the gloves really, like, it's one thing, the N95 mask, nobody touches it, there's no aerosols, doesn't come in contact with anything, but gloves are a different thing. Typically those would all be single use.
Yeah. Okay. And any best practice tips or anything on clinic sanitization, like disinfecting products?
Right. So the surface wipes, again, in the introduction, they did say healthcare levels wipes or sprays or what have you. Those are, again, are going to be very difficult to come by. So you would have to hit, the Lysols and that type of level, and then just hope that the supply chain comes up. But Costco does sell, obviously, and other places sell the surface wipes and sprays. So hitting those types of areas, but also alcohol, and that type of thing. But again, unfortunately, the healthcare level surface wipes and sprays for the short term, the next couple months have very problematic supply chain, unfortunately. So that would be
in the guidelines that did indicate hospital grade. So
so that might be something that your governing body, the physiotherapists, go back to the government and say, well, we've looked and we just can't procure this type of level. And I guess it's up to them to determine what hospital grade type of that they're looking for. But for instance, Stevens has the contract for the wipes, which is in the hospital. I'll tell you that they use, and I'll type it in here, Excel wipes here. This is, I'll give you an example of what they're using in the hospital. Right here. So this is if we had them. So this is what they use in the hospital. This is a 1 minute contact, 0.5 up to 2% of accelerated hydrogen peroxide. It comes in a canister, are ready to use. So this would be what is currently on contract with 3S Health. So this type of product, and I'm not trying to be negative in terms of the outlook, is very, very difficult, will be difficult in the next couple months for sure. The benefits of this product too, obviously, is that it's got a 1 minute contact. So there's the 1 minute, 3 minute, and this will take TB off of a surface. So that's one of the selling points of it, and TB is more related to the viruses, so they can stay on the surface. They haven't had a chance, obviously, to test it with Corona, but and to give an example, in March, the hospitals would be using quadruple the amount of hard surface wipes than they would have in March 2019. So there is a huge demand. But again, it's kind of like the masks. If you can't get the healthcare level wipes and sprays, then you're going to have to look for alternatives. And that's where I would, you're going to have to hit the Costco's and that type of thing. And even superstores and in more industrial settings again.
Okay, well, thank you, Brenda. And I did get a reference on the. I'm going to change to my screen here so I can show. There is a reference on the types of masks and PPE, just the PPE for. It's the reference from the college, but then they have a link within that. So I'm just going to share my screen here. appropriate use of PPE, and there is some information on the government's recommendations at this point as far as masks, and so it's on page 15 to 17 of that. And then a couple points as well. The N95 masks, a key consideration, you have to be fit specifically for them in order for them to be effective. So worth keeping in mind if you're procuring those types of masks as well. And the fit and seal is really important to their effectiveness, and that's why there's a number of sizes. And then, yes, on the gloves, no washing, and definitely no hand sanitizer on the gloves. So they would be more of that single use. Great. So then, question here, would a 1-to-1 ratio of bleach and water or more concentrated solution be acceptable for wiping down clinic surfaces? Bleach is readily available in large quantities. So again, the recommendations from SCBT are hospital grade cleaners. So yeah, I don't know that SPA can recommend outside of that, but yeah, for I'm not sure how things will go going forward. So
in the hospital, they do use a bleach type of wipe. So if they do come back and say that, certainly they do use bleach product in the hospitals as well. So that is, certainly a way to clean surfaces for sure.
Mm-hmm. Good. Okay. Well, we are getting to the end of our time here. I appreciate your time in sharing your background and knowledge, and helping educate us on the different products and best practices. Brenda, we really appreciate the time that you took today to help us out. And that does bring us. That does bring us to the end of our session time today. So thank you everybody for coming out. We really appreciate the time that everybody took. Just a note, we will be hosting the AGM on June 20th. We hope that you can join us. And we are looking at having a panel presentation at the considering it for the June 20th. As you exit out of the webinar, we would love to get your feedback, and then also recommendations for the for a potential panel presentation in the future for topics. Thanks so much. Bye.